If you have a painful big toe joint and you're wondering if you have gout, you might not have gout. I'm going to share the telltale signs of an acute gouty attack. I'm going to share how it happens and what you can do about it. And stick with me to the end because I'm going to share why it's so important to treat it and treat it right so you don't get these horrible complications. Hey, it's Dr. Gaffney saving you time and money in your foot health decisions. So an acute gouty attack is usually something that comes on all of a sudden and is extremely painful. And you get a red hot swollen joint, usually in one joint of one foot, usually the big toe joint, but it can be in any joint of your foot or even your knees, elbows, or fingers. So this is an inflammatory metabolic type of arthritis that usually hits one joint at a time, and it's a disorder of purine metabolism. And purine is a molecule that's part of DNA, part of your tissues, and the purine gets broken down into uric acid, and typically your body will get rid of the uric acid, excrete it out of the kidneys. But with gout, there is a buildup in the uric acid in the blood. And what happens is if it gets above a certain point in the blood, it'll start to crystallize in cool areas of your body, like your toe joints. And what happens there is it makes little needles inside a small little toe joint. So you can just imagine the inflammation that it would create and the pain that it'll create. And it happens, and this is the telltale sign, all of a sudden you get that painful swollen joint, that's red hot swollen joint, and you just cannot stand it. And most people go to the doctor right away for that. So how do you get too much uric acid in the body? And this is important because this will treat the root cause. And if you treat the root cause, you'll have much better time managing your gout. So it's usually overproducing or under excreting of uric acid, or overproducing or getting too much uric acid in your body through diet. Red meat, organ meat, seafood are purine-rich foods, in which case would break down to uric acid. Alcohol can increase uric acid in your body. Also, high fructose corn syrup, which is in a lot of processed food, that gets converted to uric acid in the liver. Chemotherapy, which causes a lot of tissue breakdown, can increase purine in the body and therefore uric acid. A lot of cancer patients are on uric acid lowering agents like allopurinol. There can be a genetic component of gout where you don't have the enzyme in your kidney to help break down uric acid to another molecule, which your body can excrete in the urine. And finally, medications like water pills, like loop diuretics, they don't allow you to excrete the uric acid, and it can build up in the blood as well. How is this diagnosed? Well, the clinical signs and symptoms, usually a single joint on one side of their body that's hot, red, swollen, very painful, that happens suddenly. Usually we need to get a joint aspirate or drawing fluid out of the joint to see if those uric acid crystals are in there. And also, gout can look just like infection, so we have to rule out infection as well. So normally we'll take that joint aspirate and culture the fluid to see if there's any bacteria in it. I can tell you the last thing someone with an acute gouty attack wants is someone putting a needle in the joint to draw out joint fluid. So we always have to numb the area well before the area of acute inflammation. So after I do that, the patient loves me because their pain goes away. So usually after that, we'll draw out the fluid, and then many times I'll put in a little bit of steroid, and that helps a lot. And then the medication that we give patients for an acute gouty attack is called colchicine, and it works especially for the acute gouty attack, and we don't know how it works, but it works. So you get one pill, and then you take another pill an hour later, and that's much better than when I first started training, where they told us to give colchicine at 1 hour and then every hour until the patient's symptoms resolve or the patient gets diarrhea or nausea and vomiting. Later on, we found that just 2 doses are necessary for the colchicine. Patients also need a very strong anti-inflammatory for the acute gouty attack as well. And classically, we would prescribe indomethacin, but that's really hard on the stomach. So you can prescribe any type of anti-inflammatory. A lot of times I'll give a low-dose steroid orally to help, or I inject the joint with a little bit of steroid. In the foot, sometimes it's hard to get joint fluid out of that tiny joint. So we also draw blood to see if the uric acid is high in the blood. So after treating the acute attack, we kind of target the root cause of the gout and then treat that. So at first we focus on the diet, so decreasing intake of red meat, seafood, alcohol, organ meat, reducing processed food, reducing the high fructose corn syrup, possibly asking the physician to change around their water pill. Now, if the patient has recurrent acute gouty attacks, despite all those dietary changes, then at that point, we may put them on a uric acid lowering agent like allopurinol, Uric, sometimes probenecid, which helps the body excrete the uric acid out with the urine. I did want to mention there is a natural way to help lower uric acid, and that's by eating cherries and having cherry juice. With those medications, the doctor needs to manage it to make sure that your uric acid level is maintaining around 6, so you don't get those crystals causing the acute gouty attack. So if you don't manage your uric acid and follow with your doctor, you could end up with joint deformity from a lot of uric acid buildup in your joint, and we call that gouty tophi, and that's like a white chalky substance, and that it fills up the joint, and sometimes it gets so bad it erupts through the skin, and this causes a lot of joint deformity, and that's why it's important to see your doctor and get treated for it and get it managed so that doesn't happen. And if that gouty tophi gets really bad, there's a medicine called Krystexxa that you get through an IV that helps to lower that and get rid of the gouty tophi over time. And that usually takes about 6 to 12 months where you get an IV infusion at the doctor's office. I've been told by a rheumatologist that if you take 0.6 milligrams of colchicine every day for 18 months, that'll have a similar effect by reducing all that white pasty gouty tophi substance out of the joint. If you have a hot, red, swollen, very painful joint, get to your doctor. It could be an acute gouty attack. You should be diagnosed properly and then managed properly so you don't end up with the gouty tophi and the joint deformity. If you've gotten value out of this, please like and subscribe. I appreciate that very much, and we'll see you next time. Thanks for watching.
Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.